All right, today we are pulling back the curtain on something a lot of people talk about but maybe don't fully understand: obsessive-compulsive disorder, or OCD. We're going to get into what it really is, what's happening inside the brain, and most importantly, how it's treated.
You know that feeling, right? That little nagging thought. Did I lock the front door? Or maybe some weird random idea just pops into your head and kind of hangs around for a second. For most of us, that thought just, poof, it's gone.
But imagine if it didn't go away. Imagine that thought just got louder and louder, sparking this intense wave of anxiety. And the only thing that gives you a tiny bit of relief is doing something very specific over and over and over again. Well, that's the reality for millions of people with OCD. So, here's our game plan. First, we'll unpack that vicious cycle of OCD. Then, we're going to take a look inside the overactive brain to see what's going on biologically. After that, we'll talk about recognizing the outward signs, and then we'll get to the good stuff, how treatment can actually break that cycle. And of course, we'll wrap it all up with a quick, high-yield recap.
Okay, so let's start with the big question. What is obsessive-compulsive disorder, really? Because let me tell you, it is so much more than just being a neat freak or liking things organized.
So the clinical definition tells us it's an anxiety disorder, and it's built on two core pillars: obsessions and compulsions. You can have just one or, more commonly, both, and they feed each other in this really powerful, really distressing loop.
And here it is, the core dynamic. The obsessions, that's the internal part. The unwanted, intrusive thoughts that just storm in and crank your anxiety up to 11. Think of a relentless, overwhelming fear of germs. The compulsion is the action you take to try and shut that alarm off. In this case, washing your hands, again and again, until they're raw. It's a desperate attempt to neutralize the thought.
Now here's what makes it a disorder. This isn't just a quirky habit. For a diagnosis, this cycle of obsessions and compulsions has to be super time-consuming. We're talking more than an hour, every single day. It has a major impact on a person's life. And you know, this is not some super rare thing. OCD actually affects about 2 to 3% of people around the world. It shows up pretty much equally in men and women, and it often gets its start back in childhood or the teen years.
So, what is physically going on in the brain that causes this intense cycle? Well, researchers have actually been able to zero in on a specific brain circuit that just seems to be stuck in overdrive.
Think of it like a smoke detector that's way too sensitive. You've got this circuit with parts like the orbital frontal cortex and the caudate nucleus, and its job is to spot errors or danger. But in OCD, that alarm just gets stuck blaring, danger, danger, even when there's absolutely nothing wrong.
And brain chemistry? Oh yeah, it plays a huge role. Serotonin is a key messenger that helps brain cells talk to each other. In this hyperactive OCD circuit, it seems like the serotonin levels are out of whack. This makes it really hard for the all-clear signal to get through. It's almost like the system is trying to run without enough oil in its gears. All right, so we've got the internal mechanics down. But how does this all actually look? How does that brain loop translate into things you can actually see? Well, the symptoms can be really varied, but they often fall into a few common buckets. The cleaning rituals driven by a fear of contamination, that's a classic one. Same with checking the locks, the stove, the windows, over and over. You also see things like repeating words, arranging objects just so, or even purely mental rituals, like trying to replace a bad thought with a good one.
And sometimes these compulsions are so frequent and so intense, they literally leave physical evidence. Someone with contamination obsessions might have hands that are always red or chafed from constant washing. Or in some related conditions, repetitive hair pulling, which is called trichotillomania, can cause visible patches of hair loss. These can be really important clues.
So, all of this sounds incredibly difficult, I know. But here is the single most important part of this whole explainer. OCD is treatable. There is real hope. So how do we break this incredibly powerful cycle?
The gold standard approach is usually a 1-2 punch. First, you've got pharmacotherapy. These are medications called SSRIs, and they work on that biological level to help fix the serotonin imbalance we talked about. At the very same time, a very specific kind of therapy helps to retrain the brain's behavioral patterns.
And that therapy is called exposure and response prevention, or ERP, and it is a game changer. Here's how it works. A person intentionally confronts a trigger. Let's say they touch a doorknob. Then comes the hard part. They have to resist the overwhelming urge to perform the compulsion, to wash their hands. The anxiety goes through the roof, which is incredibly difficult. But then, they discover that the anxiety peak eventually comes down, all by itself, without the ritual. This literally retrains the brain.
And for the most severe cases, the ones that just don't respond to the standard treatments, there are still advanced options. Deep brain stimulation, or DBS, uses a tiny device implanted in the brain to help regulate those faulty circuits. It has shown amazing promise for people who felt like they had run out of options. Okay, we have covered a ton of ground. Let's boil it all down to the most important must-know points. So if you take anything away from this, remember these 4 things. 1. OCD is defined by those obsessions and compulsions taking up more than an hour a day. 2. It's a biological condition tied directly to that hyperactive brain circuit in serotonin. 3. You can often spot it through common compulsions like cleaning, checking, and ordering. And 4, the most important one. It is absolutely treatable with a combination of SSRI medication and that powerful therapy ERP. And I just want to leave you with this. Understanding the science, understanding the biology of OCD helps us see it for exactly what it is. A treatable medical condition. It is not a character flaw. It is not a personal failing. And recognizing that simple fact is the very first step toward empathy, toward understanding, and ultimately toward recovery.